Millions of Australians are in lockdown tonight, watching our national leaders scrap over vaccine, quarantine and how we get out of this COVID rut. Welcome to Q&A. Welcome to the program. I'm David Spears, host of Insiders, filling in for Hamish McDonald. Great to be with you live from Melbourne. Joining me on the panel tonight, infectious diseases expert Michelle Ananda-Rajah, Director of Health and Aged Care at the Grattan Institute, Stephen Duckett, National Affairs columnist at the Australian Financial Review, Jennifer Hewett, in Brisbane, the Queensland Premier, Annastacia, and in Sydney, Liberal member for Mackellar, Jason Falinski. Please make them all feel welcome. You can stream us live on iView and all the socials. Quanda is the hashtag. Please join the debate from home. And our first question tonight comes from Tristan Lawrence.
Hi, David. I'm a 31-year-old and I'm weighing the personal benefits of whether I should take the AstraZeneca vaccine. While it's clear that, for me, the medical benefits tell me I should wait for Pfizer, I'm willing to take on the little bit of risk if it means that Australia can open up faster, we can open our borders, or I can protect other Australians if the virus gets in. My question to the panel is, how do I make an educated decision on how my vaccination contributes to the rest of Australia without clear information on vaccine rollout targets?
Well, thanks, Tristan. And Premier Palaszczuk, I might put that to you first. What should Tristan do?
Well, I'd say to Tristan to go and speak to your doctor, because your doctor will give you up-to-date information depending on your personal conditions, your personal medical history. But what's very clear is that there are concerns about young people under the age of 40 receiving the AstraZeneca. This has been in ATAGI advice, and our Chief Health Officer here has advised our young people under 40 in Queensland to wait until the Pfizer vaccine comes. Now, we want everyone to get vaccinated. We are pro-vax, but we know that the risks of blood clotting is actually higher the younger you are. So that's information that you have to weigh up when you go and speak to your medical practitioner.
Just to be clear, though, in your state, Premier, if you're under 40, can you get AstraZeneca at all, or is it simply advised that you don't?
Well, in Queensland, the information that came out of Scott Morrison the other night was that he was opening it up for under 40s. That was not a decision that was taken at National Cabinet. I was surprised, as were other premiers, that this announcement was made without any consultation. We had the AMA out the following day, bemused about this decision. I'm yet to hear any federal cabinet minister say that this was a decision that the federal cabinet took. And I think we need to be very cautious and look very closely at the medical advice. OK,
but it's not a ban on under 40s getting AstraZeneca.
It's not a ban, but I think everyone needs to be very clear. Now, this is the way I look at it. I have about 1.2 million people aged 20 to 40 in my state. These are not statistics. These are real people. These are people's sons and daughters, brothers and sisters, uncles and aunts. And I could not live with myself if the truth was not out there. And once again, I say to everyone, go and talk to your doctor, but look very closely, because our advice is to wait until you can get Pfizer.
Michelle, if Tristan is aware of the risks of AstraZeneca, as he said, but still wants to do his bit so that Australia can open up faster, should he be allowed to take it? What do you think?
So, Tristan, my advice is to follow the health advice, OK? And take your advice from your doctor and not from politicians. The key here is that there's a lot to actually unpack with your question. So let's just go through the stats. In young people, say 20 to 40 or 20 to 60 even, the risk of TTS is not really clear. And that's mainly because the countries that roll this out actually suspended the use of AstraZeneca when they started to see the signal in young people. So we estimate that the risk may be somewhere in the order of 1 in 20,000 to 1 in 40,000, okay, based on data from Norway and also ATAGI's own data. Now, if I said that to a patient in front of me who was 20 years old, they would wave it away and they would say, "Doc, you're overreacting," right? Here's the thing, when you start to vaccinate at high volume, right, 20 to 40,000 people a day in that age group, you're going to start seeing these cases. You'll have 1 to 2 cases per day. And the Premier is absolutely correct. In young people, TTS is not a trivial condition. It's not trivial in anyone, but in young people, it tends to be more severe, mainly because it manifests up here, all right? Now, the other thing to keep in mind is that we understand that young people are desperate to be vaccinated. They want to do the right thing for all the reasons you elucidated, right? But we would urge calm and we would urge patience, because even if you took the AstraZeneca vaccine today, your next dose, which you do require to deliver that knockout blow to the Delta variant, which is looking like it's going to dominate globally, won't be for another 12 weeks. Realistically, what's going to happen is you're not even going to get it in September. You'll probably get it in mid-October, and mainly because the GPs have a huge backlog of second doses to deliver to patients. The final thing I would say is that based on experience from other jurisdictions, particularly the UK, young people in the age of 30 are only being invited to their vaccine now. That is 7 months into the campaign. They've all had to wait. And they're waiting in a setting that has, had uncontrolled community transmission. What we have in Australia are multiple outbreaks, okay? We do not have surge scenario, and we do not have uncontrolled community transmission. So, we will get these outbreaks under control. We simply must, and it's imperative that the community follows the public health orders in order to do that, okay? Absolutely imperative. So my advice to you is, stay calm, be patient, your turn will come, and that will be sometime in September, and you will be given the Pfizer vaccine, and you will have protection in 3 weeks.
So, but can I just say though, David, Tristan's question was a policy one. He was, if I go and have the vaccine today, when will it bring forward the opening of the borders, or are there targets for opening? If Tristan has his vaccine tomorrow, it will not bring forward the border opening 1 second, let alone 1 day, because we're not going to be able to open the borders until we've got vaccination rates up in the 80%, 75 to 90%, some in that range, and basically bringing forward every person aged 45 or whatever, 35, will not change the border opening timeline.
So I should stress what the ATAGI advice is. This is the Technical Advisory Group on Immunisations. It has made it clear, and in fact the co-chair, Christopher Blythe, Professor Blythe, said today, I do not believe at this stage that young people should be receiving AstraZeneca unless their circumstances are pressed for that. Jason Falinski, let me go to you. Is it still the government's position, as the Prime Minister indicated this week, that if anyone wishes to have AstraZeneca, they're encouraged to go and see their doctor and then they can have access?
That's our position. That's been the position of ATAGI from day one, David. That
anyone, even under 40s, can
even
go
under
and get...
40. ATAGI from the beginning has made 3 different, has updated its advice on 3 different occasions. It has said that anyone under the age of 60 who is fully informed can choose to take AstraZeneca if they wish. It's a decision for them. And that, I think, is the advice of ATAGI. And the view of the federal government is that we should follow the advice of the technical...
OK, but to be clear, the co-chair of ATAGI, I just quoted, has said today, I do not believe at this stage that young people should be receiving AstraZeneca unless their circumstances are pressed for that.
We're both saying the same thing, David. So he is saying that if, in his view, people under the age of 60, I assume, should wait to get Pfizer. He's well entitled to that view. But at the same time, ATAGI has said that people making fully informed and consensual decisions when they understand the risk, if they're under 60 and wish to get AstraZeneca, they can do so.
Didn't
that has been the policy of ATAGI from day one.
If Pfizer is not available?
Yeah, it says that the original advice you're talking about, Jason Falinski, says AstraZeneca can be used in adults under 60 for whom Pfizer is not available. The benefits are likely to outweigh the risks for that individual, and the person has made an informed decision based on an understanding of the risks and benefits.
And that's one of the reasons,
Absolutely.
I think, isn't it, that we're all so confused, because this advice, despite what Jason's saying about it not changing, people interpret it differently all the time. And so there's this idea, every premier, every government clings to the idea that there's medical advice and it's a kind of monolithic advice, and it's fact. In fact, it depends a lot on assessment, on interpretation, on judgment, on risk appetite. And so you're going to get kind of different views on this. But I think the public in general are right to feel confused when all the experts are arguing very loudly, whether they're medical, whether they're political, in front of them all the time, and frankly, in a very unhelpful way.
Well, Atagi also says that Atagi reinforces the importance of providing clear communication to people who have received or are considering AstraZeneca. I'm not sure if we're getting a lot of that. Jason Falinski, you're 50, am I right? 50 years old.
Thanks, David. We've been trying to keep that under wraps for quite some time.
Are you rushing out to get an AstraZeneca jab yourself now?
Yeah, next Tuesday I'll get... Listen, David, I'm not sure anyone should follow my lead. I mean, I'm a Liberal on Q&A with you hosting, so clearly I have a very high risk appetite. But having said that, I'm getting AstraZeneca next Tuesday because my view is that I've looked at the risks, I've looked at the benefits. I think the risks massively outweigh the benefits, and if I can free up a Pfizer dose for someone else who doesn't have my risk appetite, that's fine with me.
Have you sought medical advice, though? Have you done what Atagi says?
I have sought medical advice, and before I can get it, I need to speak to a doctor at the GP clinic, which I'll do.
Okay, and then you'll go ahead and get AstraZeneca. Michelle,
I will get AZ next Tuesday.
Is that what someone 50 years old should be doing?
Look, it comes down to risk-benefit discussion, and really all these statistics that get bandied around get distilled and tailored to the individual based on their health, their social circumstances and their economic circumstances. And if they truly do make an
Sorry, what's economics got to do with health?
Oh, no, it's very interlinked with health. It's very interlinked with health.
No, sorry, so someone's income determines how the virus works?
No. Absolutely. Where have you been, Jason? I mean, the people,
well,
the people
I've been right
who
here
were most
listening to all the
severely...
advice.
Sorry,
Let's just get an answer to the question you asked.
The people who are most
Michelle.
severely affected all around the world have been the people who are most socio-economically disadvantaged. So, that is a no-brainer, absolutely. So, I think my point is that the discussion around informed consent takes all of those things into account, and that's what doctors do. And I would strongly urge anyone, to go and have this discussion with your GP. Your GPs are waiting, they're doing this every single day, and get your advice from there. And it's an ongoing conversation.
Just to be clear on this point, are you saying that those on lower incomes are more likely to be in service industry work that does have a higher risk in terms of infection? Is that the point you're making there?
Yeah, I mean, I think it's evident throughout the world that people who have been in socio-economic sort of groups on the lower end have been worse affected by COVID.
So there's two elements, David. There's low income is associated with being in one of these jobs which is at higher risk, higher exposure, and secondly, lower income is associated with poorer health status.
Okay, so Jason, you dispute that, do you?
No, I don't dispute that. I think what Michelle is talking about is that people on lower incomes in other parts of the world don't have as good of access to healthcare as they otherwise would. To somehow say that if you're
and they have
on
poorer
lower
outcomes
incomes,
when it comes
the virus. Sorry.
Right. Jason, sorry, just finish the point.
I mean, so to somehow turn this into some sort of social justice issue, when in actual fact it's about access to healthcare, not your level of income, I think is wrong.
Let me just go back to Tristan. Has any of this cleared up for you what you should do now?
Actually, yes. Like I was actually seriously considering taking the vaccine because I thought it would bring forward border closures. But thinking about the timelines in the context of the panel and the panel's advice, I'm less confident that that's true now. So maybe I will wait for Pfizer and I will go and talk to my GP if I do consider taking the vaccine. So thank you for I think this has been a clearer debate in this 20 minutes or however long it's been than I've gotten in the past 3 days.
The other point for you, Tristan, is that if you have the AstraZeneca today, you don't have the second dose for another 12 weeks, and you probably have your Pfizer, both doses, before you have your both doses of AstraZeneca.
Well, that is assuming, of course, that we do have the Pfizer
we will come to
available.
That. We will come to that. Let's get to our next question. It's a video question. It comes from Val Jackson.
I am an aged care worker, still working at age 76 after 58 years experience in nursing. I have some health issues which make me reluctant to get the AstraZeneca jab. I have tried on several occasions to get the Pfizer and have been denied. Scott Morrison announced this week mandatory vaccination for aged care workers by September. Instead of being forced to give up my career so I don't jeopardise my health, what can I do to have access to the Pfizer?
Premier Palaszczuk, if aged care workers, they are now mandated, they have to have the vaccine by September. Should someone like Val be allowed to choose and have Pfizer?
Absolutely. So, Val, if you're in Queensland, we would be prioritising you at our vaccination hubs. We have said that where the Commonwealth has not been able to vaccinate the aged care workers, you can actually come to the front of our queue and we will vaccinate yourself or a disability aged care worker. So there's a whole lot of concern at the moment out there as well, especially in the 70 and over age group. And of course, this is an issue of supply. If the federal government had organised enough supply way back in July last year, we would not be in this situation today. There could have been adequate supply of Pfizer and Moderna, and instead we're at the situation where we are days away from running out of Pfizer. We have to utilise our Pfizer for second doses, and we were ramping up our vaccinations in Queensland. So we are very concerned about this, but it is fundamentally a supply issue from the federal government.
Jason Falinski, you're shaking your head through that answer. Yeah. You don't think there's a problem with supply of Pfizer?
Well, of course there's a problem with supply of Pfizer, David. We don't make Pfizer in Australia, and Stephen Duckett has written an excellent article in the conversation over the last couple of days, which pointed all of this out. Furthermore, the federal government, the United States under Joe Biden wouldn't let Pfizer be exported until very recently. The Premier of Queensland received 55,000 doses in last month of June. Her government will be receiving 95,000 doses this week, and it will ramp up to 127,000 doses by the week end of the August. It is just simply shameless for a state premier to be blaming the federal government.
Incorrect.
All you have done for the last 8 years, Premier Palaszczuk, has blamed the federal government for your own problems created by your own government.
I'm not responsible for supply of the vaccine for the Australian population.
You will have enough supply. For you to go on national television and blame the federal government for your inability to deliver vaccines to the people of Queensland is shameless, and
that is not correct.
And it's beyond me that a responsible premier would do that.
Look, Jason, you acknowledge there is a problem with supply of Pfizer. And you point to what's coming. There will be more coming over the coming months. But, in the here and now, just coming back to Val's question, should someone who's now mandated, they have to get some vaccine because they work in aged care, should they be able to get Pfizer?
Yeah, they absolutely should be able to get Pfizer if they're in the right group, and if someone like Val has comorbidities or she has existing health conditions where she can't. The Premier of Queensland has indicated that she'll be able to go to the front of the line and get a Pfizer vaccine so that she can be vaccinated.
There's actually a really compelling reason to give aged care workers Pfizer, and that is because we've only vaccinated 33% of this group. The sector is at high risk of outbreaks over winter, and the Pfizer vaccine is delivered 2 shots 3 weeks apart. So this will actually give them full protection in the fastest possible time. And that is the number one reason these workers should be getting the Pfizer jab.
Well, let's go to our next question. It comes from David Anderson.
It's taken till this morning, till Simon Birmingham has admitted that this country is at the back of the queue when it comes to the Pfizer vaccine. Whilst they have spent months denying reality, would it have been easier and far more productive to simply admit the shortcomings and put all their energies in rectifying them, even if it meant grovelling and horse trading?
David, thank you. And Jason Falinski, I guess this just comes to the point you were just making. You're saying there is more Pfizer coming, but you can hear it, and this is a very widespread sentiment, isn't it? Could more have been done to get more Pfizer now?
Well, David, with the benefit of hindsight, I'm sure we would have done things differently.
Like what?
But the fact of the matter is, I think the fact of the matter is when we were looking at which vaccine to roll out, we looked at AstraZeneca for a whole variety of reasons. Pfizer, the Biden administration has only just allowed the export of the Pfizer vaccine. We were in negotiations with Pfizer in July. The 2 million doses of Pfizer, or the 2.7 million doses of Pfizer that are arriving next month, that isn't because we did a deal this week. That's because we've been talking to Pfizer for the last 12 months and made sure that we were ready to pounce when those vaccines were available. So we have 2 million coming in July. We've had AstraZeneca from day one, and we've been doing everything we can. Now, look, have we got everything right? Absolutely not. We are trying to do something globally, not just here in Australia, that has never been done before.
Well,
we are human beings. We are going to make mistakes, but we are going to rectify those mistakes as quickly as we possibly can.
Mistakes are going to be made, but can I quote your former leader, Malcolm Turnbull? He today has said to the ABC, "I can't think of a bigger black and white failure of public administration than this." Is it just a mistake, or is it a massive failure of public administration?
Look, Malcolm Turnbull's a former Prime Minister of the Liberal Party. He's entitled to his view, in case people haven't noticed. But the fact is that, Malcolm knows how difficult these things are. Malcolm administered a census online that went awry. In anything that people are trying to do for the first time, things will sometimes go wrong. The question is not whether we will get 100% right. The question is, can we adjust and get it right as quickly as possible?
Okay.
And I honestly believe that there have been people working around the clock to make sure that happens.
There is an alternative. Thank you for your question. I wrote an op-ed 2 months ago on May the 3rd in The Australian, and in it I talked about the US vaccine surplus, all right, and how we should procure some of that. It was entirely predictable that the US was going to enter surplus in July. And indeed, this month they are releasing 80 million doses throughout the world. Last week, they flew 2.5 million doses of Moderna to Taiwan. They've given 8 million doses to Canada, South Korea, Mexico, India. They've given 3 million doses to Brazil. They have a glut. And, what I want to hear from our leaders is that they are moving heaven and earth to get some of this vaccine.
Do you think they are?
I don't believe they are. I'm not hearing that they are. And in fact, in Senate estimates last week, when Brendan Murphy was asked this question, he dismissed it and said, we have plenty of vaccine. Now, it costs nothing to pick up the phone and call the Biden administration and negotiate. And in fact, people might say, well, we're taking a vaccine from countries that needed more.
This is extraordinary.
But you can actually negotiate. And for example, for every one mRNA vaccine we procure from the US, we could donate 2 mRNA vaccines to COVAX and be the good global citizen that we are. The money is completely immaterial. What we desperately need right now is more Pfizer and Moderna, and I think no stone should be left unturned.
Jennifer, what do you think of this argument that more should have been done to get Pfizer here earlier?
Well, with Jason, with hindsight, everything looks easy, but I think it's very obvious now that the government was both unlucky in choosing AstraZeneca and then having these problems develop with it. But I think it's also pretty obvious that at the time, in July last year, because they were so concentrating on that and the fact it could be domestically manufactured easily, they did not do as much as they should have done in terms of really pursuing more deals with Pfizer and with Moderna, who were kind of looking around at that stage. And I think now, unfortunately, we're all paying the price of that. And the trouble is now everybody's complaining, but we really can't do much about it. I mean, I understand your point, Michelle, that maybe they should be grovelling, and hopefully they are, but I'm not sure at this point whether it will make any difference. And one of the issues is that Australia, as it keeps boasting, has been so fantastic at controlling the virus. We would seem to be kind of last in the queue for now trying to kind of negotiate anything. And at the same time, Australia has, and the government, frankly, I've been really amazed at, has been so reluctant to roll out any public relation campaign either to counter the fear and the negativity of the anti-vaxxers or just the hesitation, compounded, of course, by all the political arguments about AstraZeneca, which is the workhorse.
But that's a good point, Jennifer. Back then, we were very uncertain about what vaccines were going to work. So back in May, June, we didn't even know whether there'd be a vaccine. And then a number of candidates were around. Other countries like England, US, they invested in 6 or 8 potentials. We invested in 4. And UQ fell over at the first hurdle, unfortunately, couldn't have been predicted. AstraZeneca fell over at the second and third hurdles, couldn't have been predicted. Then we had Pfizer and Novavax. And so we had a very narrow range of choices. And that was what we decided back then rather than a broader range, which I think other countries were doing at the same time. So it was not hindsight, Jennifer, it was actually bad foresight.
Yes, but you've also got the situation like in the UK, for example, at the moment. You've got a country which has been very largely reliant on AstraZeneca to get itself out of the mess and now cheering the people who developed AstraZeneca, whereas here it's just regarded as, you know, as a very, very bad option.
Let's move to our next question. It comes from Grace Primicolides.
Good evening. Lockdowns have proven time and time again to be economical disasters. With an estimated $1 billion lost in economic activity for every week that Melbourne and Sydney have a lockdown, it is simply not a viable solution to keep Australia running. What percentage of Australians would need to have at least 1 dose of the vaccine to be able to end lockdowns and border closures once and for all?
This is a question that's coming up more and more. Michelle, is there a number?
Yep. So you're really, I guess, alluding to this concept of herd immunity, right? I mean, this is where, you know, pointy elbows up and we sort of push the virus out and we stop it from circulating in the community. We don't know. I mean, that is honestly the $1 million question. We don't know what that number is. Anthony Fauci has said that he thinks that number should be 80%, but it keeps going up, right? 80% or up. And I think that's about right. I think in order to achieve anything close to herd immunity, which is actually proving harder and harder because we're dealing with these highly contagious variants. The Delta variant, for example, can infect 5 to 6 people. And generally speaking, when you have more contagious variants, you need to have much broader, much higher vaccine coverage, okay? It makes sense, right, in order to keep this thing out. So I don't know that we're going to achieve herd immunity with this generation of vaccines, but it's definitely something we could aim for with, you know, the next generation of vaccines as well. The main thing, though, is that we need massive uptake in the population. Virtually, you know, every adult that can be vaccinated should be vaccinated, and we also need to vaccinate children. That is the key. That is the key. We have seen what has happened in other jurisdictions when you don't vaccinate children. There are massive outbreaks in schools. And, you know, that's happened in Singapore, it's happened in Israel, it's happened in the US. And hence these jurisdictions are actually now vaccinating children.
And we don't even know when that's going to start in Australia. Yeah, Premier, let me come to you on this. There are various experts with various numbers, but it's difficult. Have you given much thought to what level of vaccination we need to be at to prevent you having to shut down again?
Well, I haven't heard anything out of federal cabinet and it hasn't been discussed at national cabinet. So I think it's probably time to sit down with the experts and work out what that is. But as I said, we do know that there's more Pfizer coming in the last quarter of the year and Moderna. So I think we'll see a huge uptake of the vaccination then. I'm quite sure that there'll be a very strong communications campaign then as well. But until we get the supply, we don't know what that rate is. But it's about time that some discussions happened around that. Okay. I think people want to know, people want to have a bit more certainty in their life. And like was said, you know, I think it's been very hard in Victoria. I mean, they've had long extended periods of lockdown. We've had short, sharp lockdowns, but I am very concerned about this Delta virus at the moment that's circulating, this Delta strain. It is stretching our quarantine, it's stretching our staff and resources. We're having to broaden the people that are vaccinated. We're looking at now vaccinating fly-in, fly-out workers. We're looking at vaccinating flight crew. I think will be discussed at National Cabinet tomorrow. Then, of course, you've got your aged care workers, your disability workers. You know, our healthcare workers, they're not mandated at the moment, but we're trying to do that in Queensland. So, look, the more you broaden it, the more Pfizer you need.
But
the more vaccine you need.
Indeed.
And we just don't have the supply.
On this
That
question,
is the
though,
reality.
on this question, though, about where we need to be at to stop lockdowns, isn't the head of your department, along with their state counterparts, working with the head of the Prime Minister's department on this very question? Have you heard anything back from that yet?
Not yet, but I'm quite sure we'll get updated on that. But I do think we need to give the Australian public some sort of ambitious target so we can actually give certainty to the public.
All right, well, our next question is a similar theme, and it comes from Grant Bartlett.
Hi, this is a question for the Queensland State Premier. As a Queenslander stuck overseas myself, do you really feel the right response is to slam the gate shut on Queenslanders desperately trying to return home because of failures of your government to run effective COVID-secure quarantine facilities, as well as ensuring that hospital staff, regardless if they're the administrator or nurses, are adequately COVID vaccinated?
Premier Palaszczuk.
Grant, look, thank you very much for your question. And if you are a vulnerable Australian that is overseas and wants to come home, you should be able to come home. And that is why we have said very clearly that we would like to see people coming in through Howard Springs, and why I have said that we need to have more regional quarantine facilities. Let's be very clear, quarantine is a federal government responsibility. When the National Cabinet first started, it was discussed with the states, can you help with the quarantine? And of course we said yes. Now our resources are absolutely stretched. I am at the max. I've got about 16 hotels that are used for quarantine in Queensland, and we cannot take any more. I've written to the Prime Minister to reduce the caps. But what we are seeing is a large number of people that are coming and going from our country that are not vaccinated. I've also said if you're leaving the country, you should be vaccinated, and if you're coming into the country, you should be vaccinated.
Okay, but
so
Premier,
we think that vulnerable Australians should be prioritised, absolutely.
But Grant's question, Premier, I mean, all of what you've said may be true about the problems with hotel quarantine and...
Huge problems.
But Grant's question goes to what's happened at your...
Hotels were not meant, David, to be the control for infectious diseases.
I think we've heard that point. Grant's question, though, goes to failures of your government, whether it's a domestic traveller who stayed next to international arrivals in hotel quarantine, whether it's a hospital worker who was allowed to work outside a COVID ward without being vaccinated. Aren't these common sense steps that should have been taken?
Well, David, we have had hotel breaches in nearly every major state. It's not unique to Queensland.
No.
It's in New South Wales, it's in Victoria, it's in Western Australia, and it's happened in South Australia.
But these are holes that need to be plugged, aren't they?
I'm telling you, we cannot contain this virus. It is now the most infectious strain, the Delta virus. It is going to be more and more difficult to contain it when we have something like 3,000 people in our hotel quarantine. I've got nurses, I've got police, I've got a whole range of people looking after people in hotel quarantine, and our resources are stretched.
But do you acknowledge your government's made mistakes as well?
Oh, absolutely. I've apologised for that. But it's happened in every other state. It's not unique.
No, indeed. But can you tell us tonight, how many hospital workers in Queensland still have not been vaccinated?
Well, I'll tell you now, 66% of our hospital workers have had their first dose. And in aged care, which the federal government is responsible for, 14% have had theirs.
So there's still some 34%, a third of hospital workers in your state that have not been vaccinated.
And it's probably the same in New South Wales and Victoria as well, David, if you ask them.
Is that, Stephen Duckett, is that good enough?
So frontline workers, aged care residents, quarantine workers were all in Group 1A. And for some reason, we didn't say, we have got to finish 1A. This is our front line of defence. They all should be vaccinated before we extend the vaccination to anybody else, because all of the leaks, and the Premier's right. I mean, there's been pre-Delta, there's been one leak for every 200 infected arrivals.
Correct.
And since Delta, the rate has gone up. I think Michelle has those data.
Michelle, what's the number over the last month?
Well, I know that we had been tracking at about 2 leaks per month, but last month we had 7 leaks. So, you know, I think the Premier's actually, her concern is justifiable here. The leaks seem to be escalating, and that is driven really by the contagiousness of this particular variant. And it just takes a small amount to infect a person, because it's an efficient transmitter. And so, you know, the problem here is that the outbreaks are increasing in intensity and severity.
Jason, you did acknowledge earlier some mistakes on the vaccine front. Do you acknowledge the federal government should have done a whole lot more on quarantine, purpose-built quarantine, before now?
David, I mean, I don't know. I just think in this debate...
You don't know?
Reason and logic should have its moment. We have had 380,000 Australians return from overseas using the hotel quarantine system. There have been fewer than 35 breaches of that system. That's a success rate of 99.9%.
They have been
that's
costly
almost as good as
breaches,
David Spears' success rate, I've got to tell you.
Okay,
I don't think... the only person who could have run a better system is David Spears.
Well,
I mean, you cannot... I mean, we need to have some reason and logic in all of this.
I'm not sure the
when
point
you have a success rate of 99.9%.
But the point we just heard from Michelle, in the last month, in particular with this Delta strain, we've seen about 7 breaches of quarantine. The simple question is, should more have been done by now to build purpose-built quarantine facilities?
Absolutely.
Well, OK.
Jason.
Well, there's one at the Northern Territory. Well, OK, if you want to know, I mean, the federal government is now undertaking a scheme with Victoria, with Western Australia and with Queensland.
Yep.
They are in discussions about building quarantine
And it should have happened a year ago.
Purposes.
Let's just
hear the answer from Jason Falinski. What's your honest answer on this? More should have been done by now?
My honest answer is, when you've got a success rate of 99.9% out of 380,000 returned Australians, to go and spend hundreds of millions of dollars when we already have a facility at Northern Territory, I think is something that may be future-proofing us. But as we stand here today, it doesn't seem to me like a great allocation of public funds.
Well, I think it's going to be pretty obvious that we probably will need them next year. It would have been better to have them this year. But Jason's right in the sense that they're only ever going to be for a minority of people who are coming back. And it has been, however, the fact that there has not been these very obvious flaws that needed to be plugged about the vaccination of workers, for example. And Jason says quite rightly that you need a bit of rationality and logic, but I think Australia's kind of problem has been, and I think it's been shared by everybody, that instead of rationality and logic, we've kind of veered over months now between fear and complacency. And so therefore, to your point, Stephen, that's right. I mean, I don't think we needed to necessarily say that we couldn't vaccinate anybody else until we'd had all the workers or hospital aged care workers vaccinated. But where was the campaign to insist that be done? Where was the idea of that being mandated if you wanted a job? It just didn't exist. And we've just lived in this fool's paradise for months because we thought, and we kept congratulating ourselves about how wonderful Australia was in 2020.
A lot of people tonight are living in lockdown in various parts of the country, and I want to go now to Andrew Kerins, who's in fact in lockdown on Magnetic Island in Queensland. Andrew, firstly, how's it going there?
Pretty good. I mean, the community here is fantastic, and Queensland Health is doing an absolutely fantastic job. I believe they've tested now 2,000 islanders out of a population of about 2,500, but of course it's school holidays, so I'd estimate our population at the moment is probably more like 4,000. But the island's very resilient. They've got a really good community spirit. Obviously, we get the odd Karen here and there, but yeah, look, it's a great place, and the people stick together.
So what's
so I think it's going well.
Our thoughts are with you and all those who are in lockdown wherever they are. What's your question tonight then, Andrew?
Well, my question's really for the Premier. I mean, you know, here on Magnetic Island we're in lockdown, and the latest COVID outbreak, like most, can be traced back to a failure on the part of Scott Morrison and the federal government to provide dedicated quarantine facilities. But when will the Queensland government close the border and refuse to accept arrivals until Morrison actually steps up and does his job? I think that's my question.
All right, Andrew, thank you. Premier.
Well, thank you, Andrew, for your question. And I've written to reduce the caps because our quarantine is absolutely stretched. And in relation to why parts of Queensland are in lockdown at the moment is because the original traveller that was a regular traveller leaving Queensland to go to Indonesia and back was not vaccinated. So we had an unvaccinated regular traveller leaving the country that brought the Delta back to Queensland. That's tragic. It's not good enough. But tomorrow, I'm quite sure there's going to be a number of premiers raising with the Prime Minister to reduce the caps because we are so concerned about this Delta strain at the moment. That is, it's like being in a pressure cooker. I think I described it the other day. There's just so much happening at the moment that it's a real concern. And we had this moment in time during this year to get the majority of our country vaccinated for the arrival of this virus. And now the virus is here and we don't have the supply to get our population vaccinated.
Can I ask, if you don't get the agreement that you want tomorrow at National Cabinet to reduce the number of international arrivals, will you act unilaterally, as some other states have done already, and cut the intake?
We can't because
Victoria did, didn't it?
No, it's a federal decision.
But
so
other
in the
states
past,
have done
when
this.
And look, I'll give Scott Morrison some credit here because when we had the issue in India and the flights were cut, it actually reduced the pressure that was coming into our system. But now the pressure is right across the nation. So that is why we need to reduce the number of people coming in for a period of time so we can actually deal with.
But you can do that unilaterally, is my understanding. Victoria did that.
No, you can't. You're not allowed to. It's a federal decision. That's why I have written to the Prime Minister, and that is the way we have done it in the past. So I've asked for a 50% reduction.
But other states have acted unilaterally.
You can't. It's a federal decision.
Jason Falinski?
The state governments, as Victoria did, as Western Australia has done, indeed as Queensland have done, have set caps on the number of people they're willing to accept.
What do you think about reducing the numbers?
Which by the way, David, why New South Wales has been responsible for allowing 60% of returning Australians back into the country.
Do you think, though, that the international arrival numbers should be brought down now, Jason Falinski?
David, what I would say back to an earlier question of yours is the longer we keep these borders closed, it's just a matter of cruelty. Because what we're doing is we're keeping families separated, we're keeping grandmothers from grandchildren, grandfathers from grandchildren, sons and daughters from their parents, especially when there are people who are dying.
But hang on.
We should not have this.
Your government
we should not
stopped
have this
all
country.
Australians coming home from India and even threatened them with jail for a while there. How can you now say this is a terrible human rights concern?
David, and that's an absolutely fair question. Firstly, jail terms have been on the books from the beginning of this pandemic. So that wasn't something that we brought in for India. That is something that has been a matter of law from the very beginning. Secondly, the reason that we paused as opposed to stop people from coming in was that we had, and I don't have the numbers exactly in front of me, but 1 in 5 people arriving at the Northern Territory quarantine centre who were getting on planes in India and testing COVID negative were arriving in the Northern Territory COVID positive. We were genuinely worried at that time that the entire quarantine system would be overwhelmed by people coming from India who were getting infected in flight. So that was our concern. That's why we paused for a 2-week period. Closing the borders for a day longer than we need to is cruel. It keeps families separated, it keeps loved ones apart, and it keeps people who care about one another. It stops them from being together.
Jennifer, tomorrow this will be an issue at the National Cabinet. 3 of the Labor states, including Queensland, will be arguing for a lowering of the intake. What do you think about this? Is this something the Prime Minister should agree to in this current situation?
Well, no, I don't think he should agree. But to the other point, I think actually the states, they're the ones who actually decide on what their caps are. So I'm not quite sure what the Queensland Premier is talking about. That's why you've got such a variation between the states. But to the other point, you've got the states have all had various breaches. of course, maybe you'll get slightly fewer breaches. You're still going to get breaches if you haven't plugged the obvious holes. If you don't have people vaccinated, for example, who have any kind of contact. So that's going to be a big issue. The other problem, I think, for Australia is that we keep pretending somehow we can continue to have this virus completely eliminated. And as time goes on, we're going to have to learn with the fact that there will be some of the virus circulating in future. The point is when you decide that you can allow that to happen. It was quite interesting today, I think, that Victorian Premier Daniel Andrews said, well, we don't imagine any more lockdowns, for example, if all people who could have had the virus, could have had the vaccine have been offered it. Whether or not they choose to protect themselves is a matter for them, but otherwise we wouldn't be locking down to protect them if they won't protect themselves. That is still a debate that has yet to even begin to happen here. But as other countries and as we learn, you know, this virus will continue. So
well, that in fact gets us to the next question, which is from Lucy Lekic.
Thank you very much, David, and thank you to all on the panel. And my question is predominantly directed towards Premier Palaszczuk, however, I encourage discussion. I was just wondering, why are vaccinated individuals not granted access to a vaccine passport, and why is it that interstate arrivals into Australia have to undergo mandatory 14-day quarantine if they are vaccinated? We are yet to receive any announcement from any state or federal leader that promises the regaining back of our civil liberties if we do get vaccinated. And I was just wondering if you're able to provide any assurance to Australians that if they receive the jab, that there's light at the end of the tunnel in terms of relinquishing restrictions and lockdowns.
We'll get to the Premier for a view on that in a moment. Stephen Duckett, let me come to you. This idea of vaccine passports or certificates or some sort of incentive, I suppose, light at the end of the tunnel, would it make a difference?
So the policy relies on three variables, and if you think about it, the characteristic of the person who's arriving, are they vaccinated or not vaccinated? The characteristics of where they've been, have they been to a low-risk country or a high-risk country? And then the residual is, what are the quarantine arrangements you're going to make about those people, and what are the overall level of vaccine protection in the country? So once we're at a high level of vaccine protection, it makes absolute sense to say, if you're vaccinated, you've been to this country, you don't need to go into quarantine anymore, for example. So we need to have a plan, a set of targets to say to the Australian public, this is where we're going. You can see the light at the end of the tunnel. Last year, during lockdown, we all said, yep, we just got to grin and bear this until we are vaccinated, until a vaccine comes along. A vaccine has now come along. It's getting into our arms slowly, but it's getting into our arms. We should be then saying, the next step is, when are we opening? What are the phasing arrangements for opening? And what are the targets? Is it 75, 80, 85? What's the number? And what are the conditions and so on? And we need to be having that discussion now rather than saying, oh, let's not even talk about it because it's too dangerous to talk about.
Michelle?
I think this speaks to the social benefits, right, that come with vaccination. We really haven't heard enough about that. We've talked about protection from disease, from death, from intensive care admission, but we really haven't talked up the massive social benefits that are going to come with mass vaccination. And we need to have that positive discussion instead of a very negative discussion. So the benefits are a life free from lockdowns, a life of, you know, freedom of movement. 50% of Australians have either got a parent who's born overseas or themselves were born overseas. Now, I was born in England, actually, and, you know, I have a lot of family still in England. And, you know, so we are a nation of travellers. We need to talk about the fact that we can, you know, return to a life where we could, you know, see live music again, you know, massive concerts that shake the stadiums. All that sort of stuff. We need to talk up the social benefits that come with vaccination, because that is what we crave. We are hungry for liberation, and it's only going to come with high vaccination.
But
interesting
in fact, what
thing,
we talk about is all the negatives
right,
about the vaccine and all the risks. And I think that's a really big problem in terms of encouraging people to go out and get vaccinated.
Well, Premier, let me ask you, because the Prime Minister has floated the idea a couple of times of a vaccination certificate that would mean where there is a lockdown, if you're fully vaccinated, it may not apply to you. You may be able to cross borders that are closed and so on. You and some other premiers aren't keen on that conversation just yet. Do you take the point that people do need to have some hope here?
Oh, absolutely. I think everyone's life has been turned completely upside down. I think it's been very difficult for families, for loved ones, people who have family overseas or having children or grandchildren overseas. Like, it's very difficult. I understand that. I understand what everyone's going through. But I think the issue here is we've got to get the supply right. We've got to get the vaccine rolled out. And of course, there is some work happening at the moment about what does that look like? What does your vaccine passport look like? Where can you go? But at the moment, we've seen, like, you know, people going over to New Zealand with the green bubble. But what's happened there is because it gets suspended when the states go into lockdown for those particular areas. So I think we need to get the population vaccinated first. We need regional quarantine facilities away from our major capital cities. Now, if you have your regional quarantine facilities away from your capital cities...
OK, I think we're getting a bit away from the question here.
You're not going to have the lockdowns.
OK, I appreciate your points about the problems in quarantine, but just coming back to the question here, are you open at some point to saying, if we close the border, people who are fully vaccinated can still come into Queensland?
Sorry, if you
have to close the border, people who are fully vaccinated at some point can still cross that border and come into Queensland.
I think once you get to that threshold of the population being vaccinated, and that's a discussion for the federal cabinet and the national cabinet about what that threshold is. And of course, I think everyone would support
and
that.
not before then. So you would wait until we're at herd immunity.
Well, no, the discussions are already happening, David. I don't think people should think that nothing is going on, because people are starting to have those discussions.
But what's your view at the moment? You want to wait until we have herd immunity?
I'm not saying herd immunity. I'm saying that we need to have a targeted rate of having the population vaccinated, where everyone who has been offered a vaccine, and then I think you can have a lot more freedom of movement. I mean, this is hard for businesses. This is hard for families. It's hard for people's mental health. It has just taken a toll on our society and the way we live, the way we go about things. So the faster we get the population vaccinated, the faster we can open up.
Let's get our next question. It's a video one. It comes from Laith Salem.
Then can I say, stop shutting the borders?
My question is to the Queensland Premier. Next month, you are planning a trip to Tokyo for the Olympics, and even took the Pfizer vaccine over AstraZeneca in order to do so. Scott Morrison travelled to several countries last month and returned to home quarantine. My question to you, Premier, is do you think it is appropriate for politicians like yourself to keep making trips overseas at a time when there is no pathway for Australians to be reunited with their own families? And further to this, Premier, on your return, will you be coming back into the porous hotel quarantine system like every other Australian?
Premier.
Thanks, Leith. Yeah, happy to answer this question, and I might start with the last part of it. I have absolutely said that I will come and do the 14-day mandatory hotel quarantine in Brisbane. I will not be doing home quarantine. Secondly, the reason that I would be going to Tokyo is to actually help secure the Olympics 2032 for Brisbane, Queensland, Australia. This is a very important meeting, and it is expected by the International Olympic Committee that a federal representative, the Premier and the Lord Mayor of Brisbane attend to present in front of the International Olympic Committee. It is envisaged it would be a very short trip, and upon return I would do the 14-day quarantine in a hotel, not in my home, not at the lodge.
But Premier, can you understand people seeing the contradiction here? You and your government have been railing against all these people travelling for their business, but you're saying your trip to the Olympics is very important for your job.
Well, it's important for the nation. I mean, this is the 2032 Olympics. It's worth about $14.8 billion. It actually does give people hope and opportunity, and I would hope definitely by 2032 we would be back to a normal society of freedom of movement. It would create over 100,000 jobs.
But we're talking about the here and now, and your complaints about too many people travelling for business. This isn't something...
I said very clearly that the people who are travelling overseas are unvaccinated. They need to be vaccinated, and when they return, they need to be coming into Australia. They need to be vaccinated.
Will you be fully vaccinated by then?
Yes, I will be.
Okay. Just quickly on the Olympics, they're only 3 weeks away. Tokyo had about 714 cases yesterday. Should they be going ahead, Michelle?
The population does not want the Olympics to go ahead. They're virtually begging their government to cease this. This is going to be, the hospitals in Japan are already overflowing. They're under immense stress. The healthcare workers are at breaking point, and now the Olympics are there, and it's going to be a super spreader event. I think everyone accepts that. I've seen a list of some of the mitigations they've put in place. They're just not going to be adequate. So it's kind of scary.
All right, let's get to our final question tonight, and it comes from Sophie Nguyen, who's here in the audience. Sophie.
Hello, thank you for joining us tonight. I'm a 20-year-old in my third year at university, and travelling is something that's on my bucket list like most young people. Currently, with the city lockdowns across our nation and the mixed messaging on the AstraZeneca vaccine, how can the federal government expect young people to be patient with the vaccine rollout when we can't even travel to Sydney, let alone the world?
Jason, can you understand Sophie's pain there?
Not being able to travel to Sydney, of course I can understand her pain, David. No one should have to go through that. Sophie, what I can say is I know this is hard. We are in a very difficult moment. We are undertaking, global pandemics come around once every 100 years. We've come up with a vaccine in less than a year. We are trying to roll this out to as many people as possible. I understand that at this point in time we are probably, it is darkest before the dawn, but there is a lot more vaccine coming for the end of the year. Everyone who wants to get vaccinated should be able to have been vaccinated by the end of the year. And at that point, we'll start to see the nation and the country open again. And can I say, I really applaud your spirit of exploration.
Yeah. Well, Michelle, what do you think? Can you understand this frustration that's creeping in? Yes, Australia's done a lot better than the US or Europe over the last year when it comes to dealing with the pandemic. But now, particularly young Australians are starting to get a little frustrated.
Yeah, I completely sympathise. I mean, it's just heartbreaking. We were the envy of the world in 2020 and, somehow the wheels have fallen off. And I really, just do not understand how this has happened, that we've ended up being, virtually dead last in the OECD when it comes to second jabs. We are going to get there, all right? I promise we're going to get there. This is the lowest ebb I think we've ever been. I found the last lockdown the hardest, personally, and with my children. And, but the vaccines are there. The vaccines are going to give us hope, and they're going to be, the gateway to our freedom and to our liberation. And they're coming. So we're going to have a couple of months where we're going to be doing it tough. And then September, October, the vaccines will come online, and we really need an almighty uplift, all-of-nation effort and sleeves rolled up and jabs. Yeah, that's what needs to happen. And I'm confident it can happen. I mean, if the US could administer 100 million vaccines, the plan was 100 million vaccines in 100 days. They hit that target at day 58. They then decided to administer 200 million vaccines. They hit that in day 92. We can do it, all right? We just need to put in place a plan to make that happen, hopefully by Christmas. I like that target.
Yeah, and Jennifer, we've touched on it a bit tonight, this need for a bit of optimism here. We do seem to be at a bit of a low ebb right now in Australia. What would you say to young people like Sophie?
Yeah, well, I certainly hope that 2022 is going to be a lot better than 2021, and I don't think it's good enough to keep harking back to the success of 2020. But in terms of a national effort, I think that's right, but we need to have a very big, positive public relations campaign, which has been really, really badly missing, and I don't understand why.
Stephen?
So I've had 3 holidays cancelled in Australia, 2 in Western Australia and 1 in New South Wales, so I am completely aware of the pain. But the vaccines are increasing. What is missing is national leadership. The National Cabinet has to get together and say, this is the target. When we hit 80%, this is when the borders are going to be opened, and then vaccinated Australians can travel and come back.
Yeah.
And we need to be saying that right now.
And I do think there's been a kind of incredible caution on the part of all governments, but particularly from the Morrison government after learning that the state premiers were very popular for locking down. They've really stepped back, and I think they need to step forward.
Premier, just finally, final word to you. What are the chances at tomorrow's National Cabinet meeting that you can all get on the same page with the health messaging and with a message of optimism that this vaccine rollout is going to be done by the end of the year, or at least available to all adults by the end of the year?
Well, as long as the federal government secures the supply, I am very hopeful, and I think we should
always blaming
have
someone else.
I said I'm very hopeful that we will actually get to a situation where Australians will be able to travel and meet their family and friends and not have these lockdowns because the vast majority of the population is vaccinated. I know it's frustrating for young people out there at the moment, but can I tell you, I've got 2 frustrated parents that haven't travelled either. So I think the older generation is feeling exactly the same. Everybody wants to see an end to this pandemic. And can I tell you that when we do get in that room, we do actually have the national interest at heart. We really do. And I do love working with my colleagues. And at the end of the day, this vaccine will actually help us see the end of the pandemic.
And that includes the Prime Minister, just finally. You love working with Scott Morrison, Premier?
Oh, he has his moments.
Okay. I think on that note, it's a nice place to finish. And Sophie, thank you very much for that question. That is all we have time for. Would you please thank our panel, Michelle Ananda-Rajah, Stephen Duckett, Jennifer Hewett, Annastacia Palaszczuk and Jason Falinski. And thank you for all of your questions tonight. Next week, we're live here in Melbourne, joined by world-renowned philosopher Peter Singer, Liberal member for Higgins Katie Allen, and journalist and filmmaker Santilla Chinga Ipe. Join us then. Good night.